Dr. Sundeep Salvi, the Director of Chest Research Foundation, an academic institute dedicated for research and education in the field of chronic respiratory diseases, situated in the city of Pune in India. India is not doing very well in respiratory research. A report that was published by the Indian Council of Medical Research a few years ago looked at the contribution of India in various fields of medical research. Although India is not doing well overall, but in the field of respiratory research, we are not doing well at all. Chronic respiratory diseases are a big problem in India, especially diseases that affect the airways, such as asthma and COPD, have grown tremendously in the last couple of decades, and it is also estimated that they will continue to grow in the forthcoming 2 to 3 decades. Chronic respiratory diseases include not only the ones that are caused by immune disorders or by immune deficiencies, but they're also caused by chronic infections. So infectious diseases of the lungs as well as non-infectious diseases of the lungs are quite a big problem in India. We did a study called as the Poseidon study that looked at the most common reasons for which a patient visits a doctor in India. The data of around 205,000 patients from across 880 cities and towns suggested that about 25% of all the patients who visit a doctor in India do so for a chronic respiratory problem. So it is quite a big problem, and it is expected to grow in the next near future. So amongst the chronic respiratory diseases, about 80% of the burden is accounted for diseases that affect the airways, particularly asthma and COPD. Despite this fact, there is very little research that currently takes place in this field. Chest Research Foundation is an academic institute that is dedicated for research in the field of obstructive airway diseases, with a major focus on asthma and COPD. We do research that is relevant to the needs of our country, right from understanding the burden of the disease, the risk factors, what is the current treatment scenario of these diseases by doctors in our country, molecular research as well as clinical research. So we cover the entire gamut of research related to asthma and COPD. Asthma is growing. It is growing more in children, particularly in bigger cities and towns, which we believe is because of the growing air pollution that children are breathing. But apart from that, chronic obstructive pulmonary disease is also now identified as a big problem for India. It is currently the second leading cause of death. And despite this fact, not many people know what COPD is. Earlier we believed that COPD was caused by tobacco smoking because that is what the Western world told us. But the research that we did at Chest Research Foundation clearly identified that you do not need to be a smoker to have COPD. Especially the impact of air pollution, both from indoor sources as well as outdoor sources, are contributing significantly to the growing burden of COPD in our country. So that is one of the major findings that CRF has contributed to in understanding the non-smoking phenotype of COPD. So the government needs to be taking active measures to reduce the burden of especially the airway disease. And I would suggest COPD as one of the major ones, primarily because it is the second leading cause of death in India. I think we need a national COPD prevention and control program if we need to do something to reduce this burden. The burden, as I said, is growing. It is expected to grow much further, and the risk factors that are associated with it are going to remain for a very long time. So unless the government takes an initiative, A, in educating the people about it, and B, trying to reduce the risk factors that are associated with this disease, there is very little progress that can happen in this field. So the government needs to take a policy decision to prevent this disease. And not only that, but even those patients who suffer from COPD need to get the right treatment. Early diagnosis and proper treatment is what many patients do not get in India. So the government needs to take a decision on medical education, educating the postgraduate doctors as well as the undergraduate doctors so that they can have the knowledge and the skill set to diagnose and treat these diseases better. As of now, this is not happening. India is faced with a double source of air pollution, both from outdoor sources, what we would call as ambient air pollution, as well as from indoor sources. A lot of noise has taken place in the field of ambient air pollution. And we all know the very famous Delhi smog disaster that took place last month. So we know that outdoor air pollution is a big problem, not only necessarily in Delhi, but in other cities and towns of India as well. But what is more important than that is the indoor sources of air pollution to which people are not aware about. There are various sources of indoor air pollutants that have been shown to have a significant impact on their lung health, particularly use of mosquito coils, use of liquid mosquito vaporizers, use of agarbattis, use of dhoop sticks, and even the cooking fuel that is used for at home. So especially the biomass fuel that is burnt for cooking purposes in most rural areas. These are all major sources of indoor air pollutants, which we Indians need to be made aware of before we start taking any action for them. So the big Poseidon study that we did recently gave us an insight into what do people in India suffer from. So this huge data of around 205,000 patients will now give us directions as to how healthcare systems in India need to be developed, because we now don't know the most common ailments that affect people in India. Second is the medical curriculum in India needs to be revamped. Many doctors undergo training or receive training based on a syllabus that was prepared years ago, and especially with a lot of British influence. So many doctors learn about some diseases which they would otherwise never see in their practice. Now that we know that India has these most common ailments that a doctor commonly sees in practice, they can now be used to tweak the medical curriculum at a national level. And finally, we always have had a crunch of money that we can use for research. So if you have limited resources for research, how do you prioritize your areas of medical fields? So now that we know the most common diseases that affect people in India, we can now prioritize our research areas so that those diseases that have a big burden can particularly be targeted for generating more new knowledge. The globally, respiratory diseases have been recognized as a major cause of suffering and death. There has been a lot of research that is currently being carried out in the Western world, and this has been adding to the knowledge base of doctors so that they can diagnose and treat patients better. I believe India has a tremendous potential to contribute to global knowledge base, because we do see a lot of diseases which perhaps the Western world do not see much about it, and therefore we have the patient pool on which we can do research, and this research will help inform global policies. So whatever research that takes place in India can be useful for other developing countries, both in Asia as well as in Africa. I'm a little optimistic about the future, largely because we have now started understanding the importance of taking care of the lungs. We did not know that air pollution can have had such a big impact on the way we live our life, on the health of our lungs, as well as the health of the other organs. Now that we know about this, I believe that there will be active measures that will be taken to curb the levels of air pollution, and indirectly this will certainly help in improving the lung health, which I believe has been neglected very badly over the last few decades. But I see a bright future, especially because we need to now start taking care of the future generation. We need to give them good quality air to breathe, because if we don't, we are going to create an entire generation of people who will be sick and unhealthy for a very long time. So I'm optimistic that things will get better.